Welcome. Today my topic of discussion is medical treatment of rheumatoid arthritis. Pharmacotherapy of rheumatoid arthritis. The first drug we have to think is the NSAID. It is useful for the acute disease flare-up or in the relapse stage of rheumatoid arthritis. Glucocorticoid, disease-modified anti-rheumatoid drug conventional, disease-modified anti-rheumatoid drug biologic. Treatment algorithm of rheumatoid arthritis. The first group of drug is the disease-modified anti-rheumatoid drug, and methotrexate is the first line of treatment for rheumatoid arthritis. If we get the favorable response, we can continue the treatment. But when unfavorable response, even after 6 months of therapy, we have to think about the triple therapy comprising of methotrexate, sulfasalazine, and hydroxychloroquine, or dual therapy with methotrexate with leflunomide. Now, if the favorable response, continue treatment. If unfavorable response, we have to think about the disease-modified anti-rheumatoid drug biologic or refer the patient to rheumatologist. Disease-modified anti-rheumatoid drug conventional. Methotrexate. This is the first line of disease-modified anti-rheumatoid drug of choice. 7.5 mg per week oral with folic acid 5 mg per day. Hepatotoxicity, myelosuppression, infection, interstitial lung disease are common side effect. Contraindicated in pregnancy and CKD when eGFR is less than 30. Follow up with CBC, LFT, RFT every 2 months. Sulfasalazine, 500 mg oral twice daily followed by 1000 mg twice daily. Granulocytopenia, hemolytic anemia in G6PD deficient patient. Follow up with CBC, LFT, RFT every 2 months. Hydroxychloroquine, 200 to 400 mg per day oral. Cardiotoxicity and retinatoxicity, the side effect. Follow up with visual field test every 12 months and with repeated echocardiography. Leflunomide, 10 to 20 mg per day oral. Hepatotoxicity, myelosuppression, infection are the side effect. Contraindicated in pregnancy. Follow up with CBC, LFT, RFT every 2 months. Disease modified anti-rheumatoid drug biologic. TNF alpha inhibitor. Under this heading, infliximab, etanercept, golimumab, and cetolizumab. Other drugs are abatacept, anakinra, rituximab, tocilizumab, tofacitinib. Glucocorticoid. The indications are for the first 2 weeks in acute disease flare-up, for 6 to 12 weeks in initial support of disease-modified anti-rheumatoid drug, for long duration in low dose when we get poor response from disease-modified anti-rheumatoid drugs. Treatment of pulmonary rheumatoid arthritis. Steroid with or without rituximab, azathioprine or mycophenolate. Thank you to all.